blog post is about Chalazion. Chalazion is basically what people call a stye. That's like a little bump on your eyelid. It sometimes develops after you have a cold, sometimes spontaneously. Now, most eye doctors are not explaining to the patient what the reason is. It's really because you have some condition that's called MGD, or meibomian gland dysfunction. Each lash has associated with it a little oil gland that's used to lubricate the eye, not the lash, it's really the eye. So when you have tears, like when you cry, that's the water component, and that comes from the lacrimal gland. It flows downhill, and with gravity it goes into that little hole in the corner of your eye. So the little hole in the corner of your eye is the drainage hole, the outflow of your eye. It's almost like you could think of a sink, and it's got the little thing and the water flows down. So the purpose of the oil is on top of the water layer. The meibomian glands are supposed to secrete oil that lubricates and stays on top of the water layer. It's almost like salad dressing, oil and vinegar. You got the water layer on the bottom, the oil layer on top, and the oil layer prevents excessive evaporation of the water layer. So people who are having a clogged up gland, meibomian gland dysfunction or MGD, they don't have the oils that don't come out, they get clogged, and therefore they get dry eyes actually because the oil doesn't lubricate. But if it's clogged enough, it's like a zit of the eyelid. The gland's not smart. It doesn't know that the end of it, the orifice or outflow, is clogged. So it just produces more and more and more sebum or secretions or oil, and eventually gets big. You can see the pathophysiology is a little bit like the pathophysiology of a zit or acne. The gland gets clogged and then gets bigger, and you get a blackhead. So the treatment for a Chalazion or stye is to take an extremely hot compress. It has to be uncomfortably hot, not warm. You put it on your eye for a few minutes, and then it melts that stuff. It's almost like melting a stick of butter. And then after that, you're supposed to push and try to express. Again, it's like popping a zit a little bit. And some people like using a very hot tea bag. And there are some people who think that the tannins in the tea leaves can help with the process. I've heard many people say that. And some people also like using a bag of rice because they say that the rice holds the heat longer than a tea bag. Some people use a potato. It doesn't really matter what you use. It has to be very hot. You got to put it on there for a couple minutes until it's not hot. And then afterwards, you're going to have to push and massage, and you're just trying to express the oils. That's the pathophysiology of a Chalazion. So most people who get a stye, the doctor never tells them that, and then they might just keep getting styes, and eventually they get a deformation and it looks funny. And sometimes the Chalazion is going to just get so hard and then have to cut it open and remove it. So we can surgically remove it. You kind of flip the lid, you make an incision, you get the thing out, you scoop it out, you leave a hole there, you don't sew it up, and then it could leak out. But it's kind of minor surgery. And for me, since I'm an eye surgeon, I used to do corneal transplants, it's minor surgery. But for the patient, come on, you don't want something cut out of your eyelid. It's going to seem to you like major surgery. So if you go to a doctor and they say you have a stye or Chalazion, you really have to ask them, do I have meibomian gland dysfunction? If you do, and you probably do, it's not just doing it for a couple weeks until that goes away. You really should do it chronically to make sure it doesn't come back, you don't get it again. It might have to be once a week or something like that, maybe not every day, but you have to understand this is something that you probably should be doing chronically. If you have a stye or Chalazion in one part of your eye many times, it's not safe. It might not be a Chalazion or stye. That could be a cancer. So I was taught at Harvard when I was a resident, if it's here and then here and then here and here, it's fine. Don't worry about it. But if it's always the same place, you really have to get it checked out. A little biopsy, we send it to pathology and make sure it's not cancer. Chance of that's like 1 in 100,000. I don't want to worry you, but if it's the same place over and over again, you really should get it checked out. Anyway, we kind of specialize in dry eye because we do laser vision correction. I think that I'm the #1 laser vision correction surgeon in New York City, treating dry eye first. And it's important to do that because then your healing's quicker. So again, if you have a Chalazion or stye, you can come and see us. We take medical insurance. And then if you're interested in getting laser vision correction, we could do that too. It's not mostly insurance-based, it's cosmetic, but we can take the medical insurance and the money that we got from the eye exam to kind of credit that towards your procedure. As a courtesy, you could save a few $100s or maybe even $1,000. Thank you very much, and any questions, just contact us on the blog.